In emergency medicine, we can impact our patients' lives every day. One of the ways we do this is by providing an inclusive and diverse environment. Not only is diversity, equity, and inclusion important in our department, but it is essential for healthcare as a whole. Many of our DEIJ efforts have been started by Dr. Andrea Alexander. We know that our marginalized patients experience significant health inequities, resulting in disproportionately higher rates of morbidity and mortality. We can continue to improve care by seeking to understand why these health inequities exist within our healthcare system, and by understanding and representing different backgrounds and cultures. Being diverse allows us to connect, communicate, and build trust with all the patients we encounter. We know departments that have higher diversity provide better patient experiences, resulting in improved patient outcomes. Not only does DEIJ improve patient experience and outcomes, but it also increases workplace engagement and satisfaction, allowing everyone to reach their full potential. Dr. Alexander has helped develop and drive multiple DEIJ programs and initiatives over the past several years within our department, particularly in the residency program. Dr. Alexander has led the residency program in reworking their evaluation rubric for candidates. This work led to a more holistic and inclusive review process that changed how applicants' experiences, work, and interests are considered, particularly with a focus on those candidates who have faced adversity and/or have an interest in and experience with working with vulnerable patient populations. These efforts have increased our representational diversity within the residency program from 13.7% URIMs in 2020 to 26.1% in 2022. In 2020, we started engaging in uncomfortable conversations about race and discrimination and learned how to address these instances through a DEI book club. This book club started out with our chief residents and quickly grew to include our intern class. The resulting successful conversations then led to implementing a book club for all of our department leaders. Dr. Alexander also helped in the creation of a DEIJ presentation checklist that has presenters examine their work with the DEIJ lens. For example, we expect that during resident didactics, presenters will discuss health inequities in relation to the work they are presenting. If that wasn't enough, Dr. Alexander also helped with the creation of a microaggression simulation curriculum, where in certain simulation cases for residents, a microaggression occurs. This forces our learners to address not only the medical care that is needed, but also the microaggression presented, allowing our learners to be better prepared to address these situations when they occur in the clinical setting. This year, we continue applying DEIJ concepts and lessons learned to our workplace and patients to address health inequities. Additionally, we are working to further expand our representational diversity by coordinating a day where we invite all of our URIM applicants to come see all that Indianapolis has to offer, in the hopes that they will then choose to come learn and work in our department. DEIJ is a part of our jobs. It's critical to how we take care of patients, and it should be integrated into everything we do. Dr. Alexander modeled how we can build and maintain an inclusive environment that will make us all better. Through her incredible efforts, Dr. Alexander is making changes at a system level, which will ultimately impact the care we provide all of our patients.